Clayson, tell me about the work that you've done with asbestos.
It started when I was a family doctor and I had 3 patients and I had great difficulty working out how to deal with their symptoms. It's a long story, but it led to a research project investigating the experience of mesothelioma in northern England. And that built up my practice in hospice medicine because I practice nearby the town Barrow-in-Furness, which is a shipyard town, which has the unfortunate distinction of having the highest incidence of mesothelioma in men in England. So what I provide through the hospice is palliative care, which is physical symptom control, psychological support, and care of family carers, which includes bereavement, family support during the illness, and bereavement care. I don't do it on my own, it's teamwork with a team of specialised nurses and other healthcare professionals. We also run BARDS, which is a support group, a unique support group for asbestos victims and their families. BARDS stands for Barrow Asbestos-Related Disease Support. And we set that up after we asked the population in Barrow, what do you need in terms of support concerning mesothelioma? We did that with open public meetings, questions and answers, a participatory appraisal method, which allows people to write down their comments so they're not biased. And that gave us the mandate for setting up BARDS. What people wanted was access to information, good quality information about the disease, about treatment options. They wanted local services and easy access to specialist services. They wanted support for their families, including bereavement support. So we set up a monthly support group that meets regularly, and it's actually a lot of laughs. It's not a sad place, but people with mesothelioma and their relatives come, so do bereaved people. And it's unique because we provide medical, nursing, legal, welfare, bereavement support and advice, and we signpost people to experts if we don't know the answer.
Tell me a little bit more about your research.
Right, this, as I said, this was because I couldn't find anywhere really good quality advice on how do people manage symptoms or psychological distress in mesothelioma, and yet obviously these were acknowledged to be major problems. And in fact, in the scheme of things, it's probably one of the most symptomatic, difficult cancers to suffer from. So I conducted this study as a doctoral investigation, and it had 4 parts. There were interviews with 15 patients with mesothelioma, even I can't say it. Some at the beginning of their disease and others at the end, within a few days of death. I also had 6 focus groups with bereaved relatives, and I asked them to tell me how it is. And I have to tell you, it took me about 6 months to recover from that experience, because although the relatives were very stoical and supportive and solid throughout the illness by the side of their loved one, the reaction afterwards is overwhelming. And there was so much anger, so much fury, so much outrage, that those meetings were truly rich experiences in terms of the data I got, but they were also emotionally shocking. I also interviewed 11 healthcare professionals who were heavily involved in the care of mesothelioma patients. And looking back on it rather madly, I decided I would look at the complete healthcare records of 80 patients who died with mesothelioma. So that meant trawling through their GP records, their hospital records, and their hospice records if they had them. That was quite an undertaking. And as the results were, and there were a lot of results obviously, but it's allowed me to develop some knowledge about how to best support people as far as I know. And I now lecture quite extensively on this internationally. And I think as people become disenchanted with the treatment modalities we've got at the moment, that there is an acceptance that a palliative approach is necessary, either alongside active treatments or in its own right, if patients make the decision that active interventions such as chemo or surgery are not what they want.
If a patient is newly diagnosed and comes to you or your organization, What is your recommendation?
I think that's tough because it so much depends on the age of the patient, their general condition, what their beliefs and feelings are about some of the active treatments. I think the first thing is to find out what that patient knows and to explore with them what the benefits might be for that individual from chemotherapy, which is probably the mainstay. But I don't usually have these conversations. These patients usually present to the oncologist, although some do come to BARDS for a second opinion. They come and see me through BARDS. I do think it's entirely individual because we do not have the evidence really yet of an obvious track for every patient. The benefits of chemotherapy are relatively small, and there's a price to be paid for that, and only 40% respond anyway. So I think it's important to get those messages across to patients. Surgery might be offered, but we are moving away from EPP in the UK, I believe, because it takes patients an awful long time to get over that surgery, and that might have been the best year they would have.
And what is EPP?
Extrapleural pneumonectomy. It's the most radical surgery you can have for mesothelioma. It's where the pleura, the thickened pleura, which surrounds the lung and often becomes very, very hard, tethers the lung and stops it moving properly with each breath, where that is removed, so that's stripped away from the whole of the lung. The layer inside the ribs is stripped away. The layer covering the diaphragm is stripped away with the diaphragm, and the layer around the heart. This is very, very radical, and also the lung is removed on that side. So you are left with half your normal respiratory apparatus, so you're only left with one lung rather than two. And the surgery is so drastic, it can have a big effect on the body. You have to adjust to having just one lung instead of two. It's a long, long operation, and this takes a lot of the stuffing out of people. And it's probably not unrealistic to say it takes 6 to 12 months to recover. There are complications. That may be the best 6 or 12 months that the patient may have. So in terms of the burden of the operation and the lengthy recovery time, that is really no longer pursued as enthusiastically as it was. And this is because the tumour spreads along these sheets. It's not a ball of tumour. It spreads along the tissue of the pleura.
Interesting. What is the political climate around banning asbestos in the UK?
Well, we finally banned all imports in 1999. So the government got behind that at last. It could have been an awful lot quicker. So that's been established. But of course, the problem is the asbestos that's existing in most of our public buildings, worryingly in our schools. And at the moment, I think one of the biggest campaigns concerning asbestos that's already there involves the construction workers who are at risk, but also there's increasing worry about schools, and a number of school teachers are dying each year. And so far, this hasn't really been officially recognised. So it is being pursued actively at the moment.
And how about the medical cost and care of people with mesothelioma?
Well, that's generally the standard sorts of care. Hospital care are covered by the NHS, but palliative care is still to a large extent provided by the hospice sector, which is how palliative medicine developed in the UK. And hospices generally are funded about 30% by statutory funding through the NHS, but most have to raise the majority of their funds themselves through very active and increasingly difficult fundraising. There is now, though, a national campaign being run by one of our tabloid newspapers, the Daily Mirror, which is getting a lot of public support, and that is a campaign which calls on the government to put money into research for mesothelioma, amongst other things. And we're very hopeful that this will actually bear some fruit.
Now, what do you suppose sparked the kind of radical paper, the Daily Mirror, to get involved with mesothelioma?
I actually don't know. I know it's I had a phone call from the reporter Nick Sommerlad, and he wanted to do something on asbestos, but I don't know what provoked that, and I will find out. But he moved from wanting to do stories with individuals to realising that this was a much bigger political question here about let's get something going for mesothelioma, let's get the research funded, let's get the government to get actively involved, as they have in Australia.
And what is the situation in Australia?
Well, the government set up a fund for mesothelioma, for asbestos-related disease research, and there were 11 projects that were funded through that. So it really was a catalyst to research. But I'm not sure if there may be a query over ongoing funding. I'm really not sure on that point. It's something I've heard third hand.
So what would you like to see? What would your prescription for success be if you could get the government involved?
I think they really must put some money into mesothelioma research, and that should cover the whole spectrum of activity. Yes, it should focus on chemotherapy research, which at the moment is only funded by drug companies. So they're only likely to look at things that there's a commercial gain in, and that may not necessarily be what we need to research. We need to look at accurately the place of surgery and try and come up with some definitive answers. And then there's a whole range of questions. I think I've submitted 12 at this stage, which need to be answered about palliation, about how best to help people with what is at the moment still a very rapidly fatal disease.
Tell me about your upcoming conference.
Right, this is on Friday, May the 22nd, thank you. And it's in Barrow-in-Furness, run by bards.
And what is it called?
It's going to be called, I think, the working title at the moment is The Asbestos Scandal, Its Effect on Communities and Individuals. We're inviting people to really raise the profile of asbestos-related disease and also to help people in Barrow, which is a traumatised community from the incidence of mesothelioma being the highest in men in England from the shipyard. And we're trying to raise that profile by using not a medical approach but more of a social approach. So I have Laurie Kazan-Allen, who you will know is the leading campaigner across the globe against asbestos. Greg DeLoyle is coming from Australia, and he has helped support asbestos victims and their families in Australia for many years, and is a wonderful speaker and has brilliant slides, brilliant but also devastating slides of the mining area in Western Australia. Professor Conrad Atkinson, who's Professor of Art in Berkeley, California, who was actually born in Cumbria, so he's coming home and he's going to be talking about the artist as social activist. In fact, he got into quite a lot of trouble as a social activist in the 60s when he did an asbestos installation, which the Tate has just bought and is going to exhibit. So that has also come home. And Conrad has produced work on mining and asbestos, so his heart is really looking after people who are damaged by the work they do. We're hoping that the Daily Mirror reporter will be able to come, but I understand that a baby is due, so he may not be free. If not, we hope he'll send somebody along. We'll have a speaker from UCAT, the Union of Construction and Allied Trades, and that's going to be very important now that so many victims are to do with the construction industry. And I'm trying to remember, I've also got the Michael Lees, who is the UK expert on the asbestos problem in schools. So I think it's going to be a general interest, awareness raising, hopefully quite politically focused afternoon. The one thing I need to say is that hospice care isn't just about people who are at the point of dying. It used to be when it started in the 60s, but now hospices have inpatient units, and half of those patients generally go home. They come in over a crisis or to give somebody a break. But most of hospice work now is increasingly becoming work in the community, supporting people at home if that's where they want to be cared for. And I think that's a really important development. that basically they're not just a one-stop shop.
Well, I thank you so much for joining us. I'm so glad you could come to the conference this year.
My
and
pleasure.
I hope you'll be back next year.
Thank you.
All right, we'll see you in Chicago.